I was working and everybody in my office was careful and we were fine. And then I didn't get sick until March 31st. So we had been working with it and they had been turning several units at the hospital into COVID isolation units, and doors were closed and everybody was wearing the big hoods. So they were already doing a good job of protection, and they already knew, and they had command center going on, giving reports, and it was already very well managed and very tightly controlled before I got sick. You know, usually I'm very energetic and peppy, and it was like the Energizer Bunny where they took all the batteries out and they unplugged them. And I basically spent 23 hours a day lying on the couch or in the bed. And then I was just starting to get a little bit better, and I was starting to sit up for a little longer, and I rolled over on the couch and I started whirling. Like my whole head was whirling. And then so I called my husband. I said, I can't get up because I'm spinning and I'm going to fall over. And then I got nauseous. I said, you're going to need to call 911. So he called him and he said, yeah, she's COVID positive. So of course they have a special team. There were only a few of the paramedic teams that came to COVID positive houses. So I got into the ER and everybody just took such good care of me. You know, they were obviously all gowned up and masked up and shielded up, but they tried to get me better so they could get me home, and they couldn't. And then they came back a couple hours later and said, we have to admit you because we can't get you better through the ER. You know, the 10 days of being out of steam, I didn't really think I was in trouble. But when I had vertigo, I knew I was in trouble. So, you know, I've never been sick. I was in the hospital to have children, and I've never been sick. And so I take care of sick people all day long, every day. And sometimes it's hard to be as empathetic as we need to be. But when I got back to work, I thought, oh, I understand why people feel terrible and feel miserable and can't get back to work. And yeah, so definitely I'm way more empathetic than I was. And I spend longer with my patients, and I think I listen a little more.